Vanakkam, I am Dr. S. Jayaraman. I am a consultant pulmonologist working in MGM Cancer Institute. I am the clinical lead in thoracic oncology. Every year, August 1st, we call it as the World Lung Cancer Day. In the Lung Cancer Day, we have a theme and we have the important messages to all the people. So, this year, it's a very important, mainly we have to connect the patient family, community and the medical staff. The early diagnosis is the main focus of this year. Patient connection, family support and early diagnosis. Early diagnosis is very important to prevent unnecessary morbidity and mortality. So the lung cancer, you take the world scenario. This is the number one cancer among both men and women in the world scenario. In the Indian scenario, the lung cancer is the second and fourth leading cause of death in India. So, such a very common cancer, there are a lot of risk factors, mainly the air pollution and tobacco smoking, atomic industry workers, a lot of exposure due to asbestos industries and lot of industries, exposure, air pollution which leads to lung cancer. And some of them, they genetically predisposed to the lung cancer like other cancers. So the symptom in India is a high TB burden country. The symptomatology, both the TB and lung cancer, more or less similar. Mainly the cough, blood while coughing, breathing issue, chest pain and the weight loss. These are the common symptoms occurs in both TB as well as lung cancer. That's why in India this is one of the biggest hurdle. Early diagnosis is difficult in the sense majority of the patient we see, they are taking the TB drugs. Initially, general practitioner or general medicine doctors, they overdiagnose as tuberculosis, but this is actually a lung cancer. So the presentation itself is very different. 1/3 of lung cancer patients present as classical lung symptoms, mainly the cough, blood while coughing, hemoptysis, breathlessness, chest pain, etc. Other 1/3 of the patient, they present silently without any symptoms. If you take the routine X-ray for the master health checkup or pre-employment checkup or visa purpose, you can see, we can detect the incidental finding, there is opacity in the radiography, chest radiography. Then further we do the CT scan and biopsy will clinch a diagnosis. So nowadays for early diagnosis is very important. Remaining 1/3 of the patient, they present with the advanced symptoms, mainly the metastatic symptoms. If the patient has a lung cancer, they spread into the brain which leads to seizure, fits. And some of them, they have a jaundice because of the metastasis to the liver. Some of them, they have a bone pain, back pain because of the bony metastasis. So 1/3 of the patient, classical lung symptom, 1/3 of the patient silently, 1/3 of the patient metastasis symptom. Treatment varies depends upon the staging. So biopsy is a very important thing. We have to do bronchoscopy and find out early. For the early diagnosis of lung cancer, we have a low dose CT scan. Those who are tobacco smoking individuals, risky group patients, so we do routinely every year annual low dose CT to find out whether patient has a lung cancer or not. So this year theme is very important. Early diagnosis, patient and family support are paramount important. So we have to connect through the medical staff, patient and the community. Paramount important to diagnose early. Any stage we can treatable. If it is a stage 1, 2, completely curable. 3 and 4, we can have the good quality of life we can provide by the combination treatment. So lung cancer is a very important cancer. Early diagnosis is very important. So air pollution, avoidance of tobacco are paramount important. Thank you.